So mobility today.
Okay.
Um, so I guess, I mean, it kind of has to do with, I guess, power to a certain extent, but more mobility. But first off, like how do you determine what's quote unquote enough range of motion for someone at, I guess, each joint? Like, I know there's like the accepted norms or whatever of what people technically should have, but I feel like it's, for the most part, people tend not to have those norms. So like, what's good enough, sort of, and how do you determine that?
Well, I think it's good to have those norms as references.
Mm-hmm.
But one of the things that you have to look at with normative data in any population is a lot of times it's based on the general health of the population. So you can see normative data with cholesterol, with blood pressure. It changes sometimes for better, sometimes for worse, just based on if like the population is getting sicker or it's getting less
Mm-hmm.
mobile, and things like that. So I like to have those as references, but I often I don't go there, maybe as much as I should even, because I find that I find like a low hanging fruit much quicker than
Yeah.
I need to have this sort of normative data. And then also, um, I often don't get to where people have enough complaints where I need to keep going that route. Like I want to put somebody in a process to say, okay, this is limited and you can always get more of it. And then
Mm-hmm.
be able to identify the stuff that you don't have to spend much time working on. You know what I mean? And I don't
Yeah.
think that needs to be very specific to numbers. I think it sort of becomes more obvious, like looking one side versus the other. You can have those numbers. Those numbers can be very important when you look at the body as a whole to say, okay, so say somebody's hip rotates like a total number of degrees, like between
Mm-hmm.
internal and external rotation. Like that gives you some information maybe about the orientation of the body, right? Like if they get a total of 100 degrees between internal and external rotation, that can tell you that there's more or less of an orientation issue. And the same thing with a shoulder. Like a good example would be in baseball, where if you're looking for some normative external rotation data like 90 degrees, well then you don't understand a baseball pitcher, right? You don't understand a
Right.
thrower. Like you need to look at it as, okay, they need to be more into external rotation, but then when they come forward, you wouldn't expect their internal rotation to be what we would consider a normative data. You'd want to have maybe the full arc be 180 degrees. So that kind of
Mm-hmm.
stuff is important to understand. And you have to know who you're working with. So like when you have a person where that's important, like you expect their arc to be completely changed, well then you want to have more specific numbers on that so that you're looking at, okay, you're not overworking say internal rotation because it seems limited, because it might be where they need to be relative to where their shoulder is on the backside of that. And that becomes an orientation where the ball is just in a different part in the socket, which can happen in the hip too. So I think from that perspective, you want to have those references. But then from a just getting started with treatment standpoint, I think you don't always need to go there. You can kind of get more of a sense of what's the low hanging fruit to get someone working. What have they not even thought about working on? A lot of times, just the education on breath work starts to free up some ranges of motion because it gets people moving better from the center out.
Mm-hmm.
And then it becomes like movement by movement, I would say. Like I like to look at mobility not as a joint by joint thing as much as positions that you want to be able to attain. And then like starting from that broad global approach, how do you decrease the challenge enough that somebody can spend time there? Right.
Mm-hmm.
And when they spend time there, they also have some idea of the direction that they're trying to attain. So I think all of those things need to go into place. And that's an education piece more than a specific joint piece, because I think you can give people specific joint range of motion, but it won't necessarily carry over into the thing that they're actually trying to do, because there's more complexity when you get people on their feet and things like that. So, I tend to start with, all right, what's the movement that is a big bang for your buck movement, like a squat. If you can get to like a full squat, there's a lot of things that are happening that are freeing up. And that would be my identifier of full joint range of motion, right? If you look at knee flexion, it's like, I want contact. I want hamstring and calf. Hip flexion, I want belly and thigh, right? But there's a lot of things that can compensate that it might be hard for the eye to see. So I also want to put people in positions where they can be constrained by, a ground or a table, and they have an ability to feel their compensations, right? But they need to understand the direction of the joint motion that you're trying to get from them. Otherwise, they will just be like, yeah, I can pull my knee up, and they don't really even care about the angle that it's taking.
Yeah.
So that there's a big education piece there. But once you have that education, and then you kind of have the big movement that you want them to attain, then you can just put them in different assisted versions of that and have them guide themselves there, right? Whether it's through breathing or through guided isometrics, which tend to go hand in hand.
Mm-hmm.
Then that to me is the biggest bang for your buck you can have, making sure that it's not painful, and that it's a position that's easy enough that you can actually make adjustments. Like you can guide yourself in the direction that you're limited, and that you can spend ample time there to actually be able to make a change.
Yeah, makes sense. So you really are looking at it more from like a movement perspective, like a broad movement perspective, like you said, to get low-hanging fruit before you're necessarily looking at, putting someone on a table and being like, how much IR, ER do you have, etc.
Yeah, I mean, for the most part, and it really depends on the starting point of the presentation. If I have a physical therapy patient with a pain presentation, I tend to do table test that first session. But I'll do ones that I think give me the most information, and that's always changing, right? Like I think hip extension is important, but I don't think that the Thomas test always gives me a lot of good information or something like that. You know what I mean? But I'll try it just to see if it gives me like a low-hanging fruit type of thing where it's like really obvious, and I'll manipulate people based on what actually gives me good information. So I don't know how confident I am in like my reading sometimes, and I've been a therapist for a while. And that doesn't mean that I don't feel like I know how to do it. It just means that I think there's a lot of things that are unreliable. And I think sometimes people put too much stock in a measurement that they might just be misinterpreting. Right. And I don't want to do that. So I want to put people into like more meaningful positions first and have that be my major assessment. And then I will do the table stuff to try to confirm or deny. And I'll try to be as specific as I can with it, but it needs to fit into a bigger picture, or I just don't have the confidence to say, well, like this is exactly what I'm going after. You know what I mean? Unless it's like very obvious, right? When it starts getting into like 5-10 degrees, I think people overestimate that. And I think even when that's reported, it's people eyeballing it, which means that it can't be accurate, right? Like to that degree, like every goniometry measure has like a 5 to 10 degree error. So you have to expect that. So I think you just can't put too much stock in that. Like you certainly don't want to build your whole model along that unreliability, that lack of reliability. But if you connect that to what you might see with a full movement, it can confirm things. And then now you have more information to go on, and I think you can be more confident that you'd be moving in the right direction.
That makes sense.
I also think for change, I used to be big on like knee replacements. I'd be measuring with a goniometer every time I was done doing manual therapy. And I've gotten a little bit away from that just because I think it can be misleading sometimes, because you expect changes early on in a post-surgical process. Like you expect to be able to make somebody's knee move farther after you manually manipulate them, but you also expect it to get worse with just differences in swelling, how long they've been on their feet, temperature, a bunch of different variables. And what I've noticed is like 5-10 degrees, it can make someone real excited, or it can really, think that make somebody feel like if they're losing 5 degrees that they're not making progress. And I think sometimes people put too much stock in those numbers, and they don't appreciate that it's a dynamic process. So, it's getting people to their end range and
Mhm.
just being there and making them not go into like a threat response on a regular basis, I think is really important. And making it important for the person to work on themselves and understand the process of what you want them to feel is more important than specific numbers.
Yeah, it makes total sense. It's talking about like misinterpretation of table tests is interesting because I saw a video that was just saying even on the table, it's like people tend to think like you can't mess it up, but it's like there's so many things that can even happen
Mm-hmm.
on a table, whether it's like how their body's oriented or like their I don't know their pelvis or like rib cage moving in some certain direction without really being able to tell. Like
Right.
it's interesting, but yeah.
And so you have to have a lot of different assessments that are confirming and denying.
Yeah.
I think starting broad is usually more helpful because it's not that I have like an eye for it or anything like that. I mean, I'm sure over time I have my eye is sharpened to it, but I think it's actually more obvious to the layperson, right? To the patient. It's like, can you feel like, well, you can't make contact there, right? Like, can you feel like, something hurts to try to get into that position? You either can or you can't. And then you just give somebody a little bit of assistance, right? Like say you're having them squat and then you just have them hold on. And it's like, all right, can you feel like how much deeper you are there? And then you can start to see what their compensations are. And then you just say like, all right, go in this direction. Do you feel how that's restricted? Does that cause any pain? Right. So now you're having a dialogue with your client or your patient, and you're figuring out where the corners of the pain or the onset of the pain is, but they're
Right.
feeling it too. And that's mobility to me, right? It's finding out what their limitation is, what's their limiting factor. And then having a knowledge of the relationships of the body, you can start to see, okay, well, in order for them to have that contact, one, they have to have the stability of being able to hold on, right? So that they get less, concentrically oriented, right? They can rest into the position, but it also will indicate some other things up the chain that you'll see. It's like, all right, so the only way they can get there is if they do this. So let's put them in another position that works on that thing, that compensation, right? But it stays in the essence of the bigger, broader position, right? So for instance, squatting is like an easy thing to think about because we do it in so many different ways, right? Like, so you squat with load for strength, but you also like squat to just transition from getting up and down from the ground. You squat to sit in certain cultures, right? It's many things, but when you put it all together and you get the fullest range of motion, right, you can theoretically think of, you have a bunch of contact points. You got your heels on the ground, that could be a contact point. You have hamstrings to calves, that can be a contact point. You have belly to thigh, that can be a contact point. If you go narrow enough, you can have knee to knee, right, or even foot to foot. So you can have that midline being in contact. And that's not correct. That's not the right way to squat. It's an assessment, right, that you can get a lot of information from. Just say like, where can people make contact and where can't they? Because there are people that can do that, right? And it's like, is that normative data? No, more people can't do that full, contact. But it gives you a lot of information of saying, okay, what's easier for people to get to, like joint wise? Like, are they limited in getting the belly to thigh? Are they limited in getting the hamstring to calf, right? Are they limited in getting the heels to the ground? If you put people in enough of a supported position, you can usually figure that out, or you can get a starting point and then you can break that down farther if you need to, and say, okay, let me look more specifically at that same angle, but at the ankle more than the whole body, right? So I'll take some of the complexity of the movement out and I'll try to look at just the ankle angle that we need there, or more of the knee angle that we need there. But ultimately, I'm still looking for contact points, with keeping the broader movement in mind.
Right.
Yeah.
So like squat's a big one. What are some of those you have for, I don't know, what are some other like big movements that you like to use?
So ground sitting is, ground sitting and lying are some of your best assessments. And then depending on the apparatus you have, hanging can be fantastic as well. So the ground, the wall, give you that reference for, it's like taking the table, right? Well, the ground is like the table. It's just, you have more surface area. And then the wall is like taking that surface and just putting it vertical, right? So, if your starting position needs to be appreciating like the whole spine, let's just say posture, the back of the head, upper back. And if you're trying to think about creating motion, or at least having like a stationary position of your trunk and moving your limbs around that, you want that flat reference in a way, right? It's good to have that flat reference for yourself and for your client or patient, because you give them some information about how moving a limb, an upper limb, might affect your back, or might affect your pelvis, right? And you start to give them that information, but you can obviously see that as well. So just something as simple as start with no movement of the limbs really, but like, what is it like to just lie on your back with your legs straight, like completely supine? And then you start, you're going to see some naturals, right? Like your feet will turn out, your hips turn out. That's normal. But then what happens when you try to ask people to just, okay, have your toes point up? All right. Do you feel any pain there? How much of a sway is in the lower back, right? You look at that first and observe it. And then you also ask the person what they feel, if they feel any discomfort, right? And they may not have enough body awareness. They just feel like, no, which is fine. So you can move on from there. And then you can have people go arms overhead, right? And you can see what that does. Then you can have people turn and say, can you touch your fingers? Can you touch all of your fingers? Which, if you can touch the pinky, which looks a little bit more at external rotation, and then you can see what happens there. Do the elbows stay flared out, right? Like how much can your arm get in line with the ear? So you can just get a lot of information by having some guide of contact. You're trying to guide someone to contact a point, right? When you're lying on your belly, then you have gravity working in the opposite direction on you, right? So you can lie prone, your arms overhead that way, and just see what that looks like without any type of elevation. But then you can load like a foam roller or a half foam roller under the arms to try to get your arms up into more of a flex position, see what happens there. And then you can start cueing people in the direction that you think they need to go, right? And a lot of times the first thing is just to teach people how to breathe, because the breath is that movement that moves your trunk, that's from the inside out, right? It's the most subtle, but it's also the most controlled movement when you're trying to make postural corrections. Because what's the problem with like correcting someone's posture from a more broad perspective? Well, it's like that you overcompensate, right? It's like, okay, I'm going to give you one cue about your posture, like bring your head back. Well, you bring your whole body back, right? But you might bring your whole body back, and then something has to give so you don't fall over, so your pelvis might tip forward, right?
Yeah.
And there's no reference for that when you're in open space. So the ground and the wall give you more reference. And what you often find is that when you think about posture or you think about mobility, it's really just set the position and breathe, right?
Yep.
And the more you can set the position with more control, less effort, and you can spend more time there, you realize how subtle some of the stuff is, but that the breath really is the thing that can get better and better and guide you more and more. If you try to be too aggressive, you're just going to compensate.
Yep.
So mobility, not about stretching, but about finding the limitation that you really have, like the position that you want to ascertain, and then basically not compensate out of that, and spend enough time in there that you can actually allow your body to get more comfortable with that. Because I think a reason that people get limited is just because it's easy to do the same things over and over again. Like even if you're an active person, it's easy to never move or very rarely move from certain angles and certain places, because it's very easy to compensate around that. So you need something to just show you the difference. And then once you get to that place, you realize like, I can't do much here because I'm at the end of my range of motion, right? That it wouldn't be a restriction if I wasn't. Like if I can make a lot of movement happen in like a stretch or something, and then I'm not hitting a place where I'm actually that limited. Yeah. So I have to get to a place where I can't really move that much, and then I have to be able to breathe and somehow create motion in that end range restriction. And that, you can do isometrics there too, but it's got to be gradually ramped up. Otherwise, you start doing too much too quick. Your body's just going to come out of the position that you don't own.
Yeah.
Right.
Makes sense. What yeah, no, it's funny because that like the overcompensating and like how subtle things are something I literally struggle with every day when I'm trying to put myself into certain positions. It's like if I think I know what I want to feel and I just go out of my way too hard to try to feel it, it's just
Yeah.
I don't get there. Versus if I'm just like can get myself to relax and hang out and be more patient, then it's way better. But it's interesting how it differs.
And I think mobility and endurance and aerobic capacity, they are tied in with each other. And if you really think about it, because you have to be able to do things longer to get aerobic, you know, in a way, right? Or for the most part, and that's also means you have to let go of some of the intensity so that you can do things longer, right? So duration is really important with mobility. It's what endurance is, right? Like the defining principle of endurance is doing things for a longer duration, right? So you need to be able to find that energy conservation in your mobility so that you can just spend more time in that position, right? And that's where I think you can look at the same movement and you can define it as a squat or as a deadlift or a hinge. But whatever your intent is going to dictate whether are you working on mobility or are you working on strength or are you working on power. Well, a lot of that has to do with duration, right? Can I spend a lot of time here? I can't spend a lot of time under load, right? At least under a load that's meant to be promoting strength. Then I'm not promoting strength, right? And I'm not promoting power unless I move fast and I do that abruptly and I do that for not a long period of time. So if I'm spending time in a position and I'm able to be there comfortably, I'm not surviving it, right? I'm actually in the position and getting more and more comfortable in that position, then I am working on mobility. You just have to have some type of constraint to teach you where that position is, because it's really easy to just say, oh, I think I'm in that position, but your body's compensating out of that.
Yep. How does this assessment of mobility sort of change between a Gen Pop client or versus like an athlete? So, because sort of from things I've taken in, I've gotten somewhat of the sense that it's like, well, at a certain level, you're going to hit a threshold in force production where you're going to start to lose movement options. Or like, do you treat that differently? I guess it would be yes, but like between an athlete and a Gen Pop client, because the athlete probably has to retain more of those higher levels of force production. And how do you sort of balance, those two different ends of the spectrum?
Yeah, I think with an athlete, you have to expect asymmetries, and you want to really understand what to expect, especially from real professional type athletes, like non-amateurs. And you don't want to try to like treat everybody like, all right, I'm trying to get everything back to balance. I don't want to bring you back to complete symmetry, or even really start there. So just knowing those references and saying, okay, you're actually, although this looks, really imbalanced, like for you, that's actually going to be fine. So I'm not going to spend as much time working on that, but I might work on, something else that isn't mobility oriented. Like if you don't have that reference, then you're going to start chasing things that you shouldn't be chasing.
Yep.
Right. So that's for an athlete. I think for a non-athlete, you may have to pull people back to center. You might just start from the center out a little bit more and just say like, okay, yeah, you have these asymmetries and asymmetries are expected. But let's try to restore as much balance as we can. And even if it's somebody who's like a former athlete and they have very obvious restrictions and asymmetries because of the sport they played, this is a good time to like have a conversation. It's like, how much are you still playing? Do you want to maybe reshape your body in a way so that it's not so much built for what it was built for before? Right? And I think that's important to have that conversation. Like when an athlete turns into Gen Pop, then you might start treating them differently. If they still have aspirations of playing, that you just want to have that conversation and educate people on that. A lot of times what I'll focus on with asymmetrical athletes is just teaching them how to move from the center out. So again, it always comes back to, are the breathing mechanics there? A lot of times they're not for people, right? And it's like, I don't really put them in an end range too quickly, because I'm having them work on stuff from the trunk. And then, we see what happens then with range of motion. And if range of motion is needed, then you go after it. Right. And that's been my population of late. When I was in the clinic more and I was seeing people post-surgically, right? Like that's, I think, a bit different, right? So you have to really know what you want to get people back to and be a little bit more specific with that, because there is a very specific structural thing that's happened that you have to try to work with, right? But surgery is very different than any other, instance where you have somebody who just has like an overuse injury, or you just have someone that you're looking at and they really don't have any complaints, but you're just trying to give them the most movement options without stealing their performance. But to your question about, the force production piece, like I think with the general population, you need to be less specific, and you do with the high level athletes. It really depends on the position and the sport, but I don't see that necessarily the athletic population has less mobility because they have higher force output. I think because our culture is so sedentary by nature, like the general population is just like, they're a lot of times worse at almost everything. But that's, you could say that with an exception. Depends on how specialized, some athletes are. But if you're just trying to teach people, like a lot of times athletes will pick that up quicker. They'll have more resilience to actually start working on new things, they'll be able to tolerate more volume. They just need the education to be guided maybe in a different direction than what they're used to. But I don't see that they have like more mobility or less mobility because of more force production.
Yeah, but it's definitely, I get that, thinking about that now, just because I wasn't thinking about how sedentary people tend to be. So it's like that's going to have its own effects. So then I guess at a certain point you sort of can be, especially with like general population clients, training sort of both at the same time in a certain stance and improving both, I guess, for a long time, right?
Both as in mobility and strength and power
and like, yeah,
and force production. Yeah. And I mean, I think if you put movements into a continuum, right, then you can, it's like you don't have to specialize or isolate things as much, right? So if you just have someone who's working on squatting with load, you can also have them do like a warm up or like just a squat that's with assistance, and you're putting the patterns together. You're making the adjustments for the difference for what would be trying to get more mobility out of it and what would be getting more load out of it. And then you do the same thing with like ground sitting. You just have people spend more time on the ground and understand a few different positions on the ground. And you can get really a lot out of that. You just have to make sure that people are doing it more than when they're with you. Like there's no way, in my opinion, that you can get mobility just, even if you're coming in like 3 times a week, like you have to care about it. You have to like want to put the work in. It's not going to be a quick process. And I mean, you can make change really quick, but like that, for that change to sustain, it's, I think it's a pipe dream. And I think sometimes the quick change stuff almost makes people a little confident that it's like, okay, I don't have to have a program that I'm working on routinely because I can make this change. And I feel like my shoulder moves better every time I do 2 minutes on a band or something like that. But to make actually more lasting change, or just feel like your starting point, pre-warming up is just better, then you definitely have to put more time into it. And it's usually more time than anyone gets from their trainer or even their therapist. They just don't see people enough. And you're not going to get it in 6 weeks, like, which is a normal process of physical therapy. Like, you need to get the education from your therapist, and then you need to actually give a shit to work on it and appreciate that it's an ongoing process. And sometimes you're working more on that. Sometimes you're working more on force production, but it's in the mix at all points. And you see how there's a relationship to that with other things that you do. And sometimes sometimes the force production is stealing some of that motion, but as long as you are understanding the relationships there, you're like, okay, I need to do a little bit more of this now. And that is part of fitness, right? I think sometimes people get into like force production, strength building, that's part of fitness. And then the mobility stuff is just like, I got to do it so I don't get hurt. I just think
Right.
yeah, like mobility is part of fitness. Like if I want to go more mobility heavy, then I'm going to do, maybe I go, more yoga centric. Maybe I'll do more FRC stuff, gymnastics, all that.
Yeah.
Like gymnastics has just this built in mobility that you have in it. And if you tell me that's not fitness, then okay.
Yeah.
You know what I mean? So it's just have more versatility in your game. Especially for the Gen Pop, because you don't need to be specializing in anything too much. Like you don't have a sport that you need to grow for, to be a bigger mass, to not get knocked over by the competition, right? Like you just need to be willing to change it up based on what your body's telling you.
Right. Yeah. And yeah. I mean, I guess I've experienced this firsthand with you, because it's like I'm someone who probably needs a lot more mobility, and spending time doing, like, I still sort of sometimes mess around with some of the gymnastics body stuff you gave me, and like it's just like time is so crucial. Like it's not going to be a quick change, and even if you do get the quick changes, again, it's not like getting it to stick is the show, I guess, to a certain extent.
Yeah, and getting that mobility to matter with something else, right? So you don't just do the mobility work just to do the mobility work. You tie that into a harder movement that you're trying to attain. And you could say like the gymnastic movements, like the harder gymnastic movements, so, well, they're not meaningful to begin with. But then, what is, right? Like if the squat is meaningful, well, because it helps you function. If you are able to balance on your hands better, and you have more stability in your straight arms, it definitely carries over to things that you don't even realize what it carries over to. But I think just having a hard goal of like being able to do one thing once, like a hard thing once, is a really good thing to have in your repertoire, because you can have that as your guiding principle for, all right, in order for me to do this hard thing, like a planche, I need more mobility in my wrist, but I also need to be able to stay expanded in my my upper back, otherwise I'm going to collapse forward, right? Like, so you start realizing where these subtleties that are in some of these movement models that are very they're vast, and they can be a little bit nuanced. You realize like where they fit into just being able to control your body better, right? And I think having practices that call for a lot of mobility, but they're more meaningful than that, they are your fitness, becomes really important. Then you realize, okay, I need to do more of this to get myself into that, right? And that could be arbitrary for what those movements are, just based on what's meaningful for you. But I think you look at it from like a fitness or a longevity standpoint, you just want to be able to get up and down off the ground well, right? And there's a lot of mobility that's involved in that, and you can get a lot of assessment right there, where it's like, okay, this is what somebody can't do right now from a getting up and down from the ground standpoint. Let me give them all the mobility to make that as easy as possible.
Yeah.
Right? And if I can do that, then I don't really think I need to care that much about anything else. Now, if somebody's hurt, then you have to backtrack from pain, right? It's like, okay, so, maybe you're taking too much stress in this area because this doesn't move as well. And then that's where you start backtracking from pain. And then you're seeing if the pain gets better with the interventions that you do, right? I don't think it's always though like that the interventions make the range of motion change by like 10 degrees. It doesn't necessarily stick. It might happen in a session, but what you start to see is just the exercise that's working on the mobility starts to decrease the pain. And now somebody gets involved in that, and that becomes something that they feel is a relationship to what was creating their pain. Right? So, I don't know that always gets separated out. Like when people talk about mobility, they think of it as like range of motion measurements. And then they connect that to also when they give somebody a mobility drill, something that's taking someone closer to end range, and it helps to decrease someone's pain, they think that they improve the mobility. And it's not necessarily true. It's just that you started actually looking at the mobility. You started looking at that end range in a position. And sometimes that's all it takes. Right? But you can then measure that, 5 years later, and someone's out of pain, but they haven't actually gained that much hip motion. I think that happens a lot.
Yeah. So then what do you think, like, what are some things you think are happening there then? If maybe they do end up being the same, but they get out of pain. I guess pain is just so multifactorial that it's hard to really pinpoint. But
yeah, I think pain is about pressure and stress from a mechanical standpoint, not about something that needs to be like elongated or anything like that. So if you just put somebody in a position which has them start moving in a direction that they're not used to moving, and it's a good intervention when they're not compensating the way that they normally compensate, like when they can really feel their restriction, like sometimes that's enough because they've gotten into a movement that they just never get into. So it starts to change the pressures that have built up there. And if they can do that, almost like taking a pill, where it's like, okay, just do this for 2 minutes, they can take themselves out of pain. Now, it's my estimation and my experience with my own body that you do things for long enough, you'll start to gain range of motion, right? Like that. It's just like your new normal is like you don't have to take as much time to get into a position and things like that. But I don't think that always carries over to goniometric measurements.
Yep.
You know what I mean? Like, and the body is too integrated, to really be able to be sure that you're making those changes, unless you're getting into a more like scientific laboratory environment, which happens. But then that, like, so we get information out of that scientific information when we're putting, sensors on joints and really measuring specific angles, but that's never the same thing that's being done in the clinic. So you can't, you can't draw the same conclusions from the changes that you're making in the clinic to what you're seeing in a more stringent scientific laboratory, right? We can infer, but you can never say that's the same thing because the measurement is just so different. So I don't think you always need to like be very specific with that measurement. Like you should know where you're limited. You should know how you compensate with that limitation. You should know how to work on that. And you should know when you're not working on it, what the consequences would be. And then you have your information. You're in control then of your own body, though. You're in control of your own process. And then pain becomes this thing which will tell you what to do if you listen to it, right? And I think it's going to be, as anybody gets older, it becomes the thing that will be the biggest limiter, but it should also be the thing that makes you switch gears, in my opinion, right? So you have to have a lot of gears to be able to switch them, but if you do, right, so say you're like on a program for deadlifting and you tweak your back, right? And tweak it to a point where it's like, okay, I'm not going to deadlift anymore today.
Yeah.
And then you feel like your body is moving a little gingerly. Well, maybe you have to drop and you accept that you're dropping the program that you were in with deadlifting, and then you just switch gears, right? What you'll find is a lot of times that makes you feel better, right? Instead of like totally saying, okay, I got to shut down until I can get back to that program, just be able to switch into another program and be from day one assessing what that symptom will allow you to do, right? But the more interventions you have, right, the more movement practices you have, the easier it is to do that. And then pain doesn't limit you. It just makes you switch gears.
Yep. Yeah, definitely have experienced that myself. I'm sure you have.
Yeah.
Like,
today?
Today?
Yeah. I mean, I was in the middle of deadlifting and I felt one I didn't like. And then I'm like, all right, I'll see how I feel tomorrow, but I'm willing to drop that and, it's work on something I haven't worked on in a while, right? Which I will give me more control over not stressing that area for a little while, right? I find it happening a lot more now, where it's like if I'm in a program for too long, and it doesn't even have to be like super heavy load. It's a lot of times it's more the volume that builds up, or it's just like I just like one rep tweak something. It doesn't limit me too bad, but it's just like I just can't do that particular thing that tweaked it. But something else at a different angle is fine. And then certainly anything I do that's like mobility heavy just feels better. Right. And
Right.
so it doesn't become anywhere near something that would be chronic. It
Hmm.
just becomes, okay, I have to not be in that specific program. So,
Yeah.
and then the more things you want to explore, sometimes pain becomes this thing where it's like, okay, good, I wanted to get back to this.
Yeah.
You know what I mean? It's like I have to quit my program a little early, but that's fine. I wanted to get back to doing some of this anyway. You know, it's like I want
Yeah.
to get into gymnastics again. So it's just like good to have as many things as you can do. But bringing that back to mobility, it's going to be, you may have to do more what would be considered like mobility based movements, which is getting yourself to end range, directing yourself, spending time in positions. You might want to do more of that when you are recovering from a new injury or a new tweak or something
Hmm.
like that. But that should be part of fitness, right? So you shouldn't be like discouraged about that, in my opinion, especially if you're a general population individual. You should be like, okay, it's an opportunity now to work on this.
Yeah. Yeah. It's funny. Like, I think I think I've seen posts or something. It's like you can do all the mobility in the world, but like if you're getting pain like every time you lift, maybe it's time to just
Yeah,
maybe you just need to switch the program.
right. You need more in
And
your boat.
yeah,
Right?
exactly.
And this is where we've talked about this before, the difference between thinking about fitness and competition and
Mhm.
health all in the same, meld, because they're just very different things, right? When you have somebody who's a competitive athlete, you just have to think totally different about what you're doing with them, right? So you need to get performance out of them. That performance has to be specific with what they're doing for a living. And you have to, like, if they do get hurt, like, you don't have as much freedom to manipulate things, right? Because they have a very specific timetable oftentimes that they need to keep. They have a schedule that they need to keep. Like, they can't explore as much, or there's consequences if they are, right? If they're not able to be in a program that's very specific for building mass, then that's going to harm them on the field, right?
Hmm.
But that's very different for somebody who's trying to be healthier, right? And they don't have that competitive element. It's like you really want to just balance out your attributes as much as you can. So that makes it a lot easier to let go of something and just shift into something else, because the more you're spending time on one thing, the less you're spending time on another. So that's a mentality thing, though. That's not, I don't think that's the general population's thought process of fitness, where they'll think of it as like, I just want to pick like one thing that I do on a regular basis. And as long as I'm doing that in a routine, I got that box checked, right? So
Hmm.
if I'm doing Orange Theory, well, I'm working out. I got my exercise covered, right? If I'm doing CrossFit, I got my exercise covered. Instead of looking at it as like all the different attributes within that exercise that you might be touching upon, but you can be more specific on one, and you can really go deeper into one if you need to, if that's the thing that your body tolerates and your body's not tolerating something else, which
Hmm.
is a very valuable thing, to always know that you can go deeper in any of those attributes.
Yep. Yeah, totally. And it's just that, like, I think the whole idea of checking the box for like working out.
Yeah.
It's like, well, you could just be doing the same thing over and over for years, and it's like, well, you build up this one foundation of something, but like you're like Mariana's Trench and some other qualities, like,
Right.
and then you're just not a balanced. Like, maybe you're fit in that certain thing, but you're not healthy.
Right. And I
Yeah.
think your education is limited too. Like
Mhm.
you become more and more knowledgeable maybe about one thing,
Right.
or you just you don't, not even knowledgeable, but you just know what your body feels like doing one thing, and you just miss out on all these other opportunities. And it creates this scenario where any injury becomes really fear producing,
Yeah.
because it's threatening the only thing you know, right? It's threatening this idea of, I had my box checked and now it's not checked anymore. And
Hmm.
I have to check it again, but I can't check it until the pain goes away. Instead of having other boxes that you can easily just drift into and say, like, this is actually going to get me better back to that quicker if I want to. But I'm also going to be less likely to have a catastrophic injury if I'm not putting all my eggs in one basket.
Right. Yeah. It's so much of it seems to me between mobility, how, like all of this is just education more like, yeah.
Exactly. Right.
Yeah.
I mean, and models are really helpful to give you a starting point for your education, but sometimes, especially with mobility, I think they can be misleading, because a model tries to make the learning process linear, right? It tries to make it like you need this before you do this, right? Instead
Yeah.
of really looking at it as a continuum where you need to understand all of the parts, but you also need to understand that you can't do everything all at once, right? But I don't think it's linear where it's like you need mobility before you do strength,
Yeah.
right?
I agree.
But that's sort of the template a lot of times.
Mhm.
And I think it can be helpful to a certain extent from just a learning process where it's like, well, this prerequisite range of motion is involved in this movement that you're doing, but nobody is actually getting that full range of motion anyway when they're doing things under load. So
Yeah.
like I think we know, but how does it compensate down the chain? Like so, if we know those relationships, then we can understand how to balance that out over time. But you can't wait to train someone for force production until they get all like full mobility, like or no one's training. And
Hmm.
even the people that are teaching the model aren't training, right?
Yeah.
So you need to know like what's more important for me to be working on. You know, am I getting beaten up more with the high force production stuff, or does that make me feel more robust? Or does that make me feel more resilient? Does the fact that I train regularly and I keep building up strength, even if I tweak myself doing that from time to time, but I have more information and more knowledge about how to work with those tweaks, does that make me more resilient? I think it totally
Mhm.
does, personally. But if you have a model in your head of saying, well, every time I tweak, I'm damaging something, and then in 20 years, I'm going to be broken, then now that changes your mindset. And there's no evidence that that's true, but that's a lot of people's mentality where it's just like, well, every time I injure myself doing something, especially if like you're noticing you're getting tweaks more frequently, that's leading to some type of degenerative process that I won't be able to come back from. That's, to me, that's fear that
Yep.
is unwarranted. And you need to actually make a personal decision there, but if that's a limiting factor, that at least has to be discussed, because you have to think, where's that coming from? Is it coming from advice that you got? Well, where's that advice coming from? Like, I think you got to trace that back and start to see like that this pain thing or this these injuries that might happen with your training, they're part of the training that need to be taken into account. And the better you get at using that discomfort, the more robust and resilient you'll be. You won't be afraid to do things. You'll be like, okay, even if I get hurt, like I know that I can do something else. I can come back from that, right? I'm not gonna be broken. I'm not gonna lose my job. You know what I mean? It's like, and sometimes catastrophic things happen, no doubt, and it's like it's beyond your control. But I don't think being in fitness and strength training and all of those things and progressing with that's the thing that creates the catastrophic injury,
Right.
like the chronic stuff that you don't come back from. I haven't seen that at all. I've seen quite the opposite.
Yeah. It's and I'm just going back to your point about like the models that sort of sell mobility before being able to train. It's like, well, then I mean, especially if you're a personal trainer, like you're not going to get clients because
Right.
like everyone's just going to be doing stuff on the ground or whatever, and then
Yeah.
they don't make changes. Like for people that I feel like a lot of people want to just look better, and it's like,
Okay.
well, then they don't see any changes. I don't know. I just think, and then that sort of instills that same sort of in a different, coming from a different direction, like that sense of fear that it's like, oh, I can't do this stuff.
Yeah.
If I don't have this motion.
Right.
And like you said, it probably makes you more robust and resilient in the long run to, go into some of those areas that are a little more gray.
Yeah.
But,
Yeah. I mean, one of the common questions I get when I see people that are coming in for early personal training, or they might be even a physical therapy client, but they don't have too many limitations from a pain perspective, is they'll ask, can I do the group fitness that I was doing before? And for the most part, my answer is always yes, especially if you're coming in on a regular basis, because now I get information about what you're struggling with, and now we can tackle that very specifically, and that would be one of the best ways to use our sessions. And instead of trying to make some blanket judgment about group fitness, like I can definitely make blanket judgment about the more people that are in a group, the less you're going to get specific treatment from a coach that's going to protect you. But at the same time, I don't think that's the goal. Like you'll never get that. So that would be like me saying never do group fitness, right? To anybody, because you need to be the one to self-regulate yourself. And that would be my job, to teach you how to self-regulate yourself. But without you actually trying the thing that you want to get back to, then I don't know what I have to manipulate for you, right?
Yeah.
And then it depends on how sensitive people's symptoms are.
Right.
But I think one of the best things to do is just say, like, all right, what is the specific thing that gives you the most trouble? Because now we're onto something. Now we can work on it. Now we have the thing that's the most meaningful to the person that we're working on every session, right? And it's, part of it's going to be some range of motion numbers perhaps, but sometimes it's just, how do I show that someone how to scale things the most appropriate, and then also tell them, like, this is where you are now, but this is how you get back to where you want to be, or maybe you never were where you needed to be. Like that's very common too in group sessions. Like when I start breaking some movement patterns down from a safety standpoint, or working around symptoms, it's just like, well, you never had the control to be able to do this without putting that exact stress on your shoulder. So this is how you have to do it because it doesn't hurt your shoulder. But even if the shoulder pain goes away, know that's the same thing that was putting that exact stress on your shoulder that was hurting. So it's your decision then if you want to keep doing that, right? Like that becomes a lot more meaningful. But there's no class that you can go to, or that you go to, that you can't make those adjustments on a regular basis. And then it's, for me, it's about the social life, where like, if that's really important to you to go and have that social experience, it's a lot better than, getting your social experience at a bar or other places.
Yeah, definitely. Yep.
All right. Awesome. Yeah, this is a good conversation. So we'll be in touch. Have a good one.
Awesome. Thanks, Chris. See you.